A 47-year-old man is referred to the outpatient psychiatry clinic for a depressed mood. He was diagnosed with pancreatic cancer recently. Since then, he has not been able to go to work. Over the past several weeks, he has had significant unintentional weight loss and several bouts of epigastric pain. He lost his father to cancer when he was 10 years old. After a complete history and physical examination, the patient is diagnosed with major depressive disorder, provisional. Which of the following statements regarding this patient's psychiatric condition is true? This patient must have anhedonia or depressed mood. Yes, this is the correct answer for this. And this is again one of those questions where you just need to know the definition. So guys, in first aid, try to remember all the major criteria like schizophrenia, depression, PTSD, adjustment disorder, anxiety disorder, what is the duration of time for diagnosing them, and which are the minimum number of therapies, because these are very important in psychiatric disorders. Okay, so this is very typical, a very typical question which is asking you what is the diagnostic criteria for a depressed mood. Okay, patient has come for a depressed mood only, they're saying. He also has cancer, right? Yeah, he has cancer, and he's diagnosed provisionally with major depressive disorder, which of the following statement is true. So obviously, if it's diagnosed with depression, you must have anhedonia, which is lack of pleasure in things, or depressed mood. Patient may have a history of elated mood. If he has elated mood, then it's more likely that he has mania or hypomania, which would make it bipolar disorder. And we are talking about major depressive disorder. Patient may have preserved social and occupational functioning. Usually, to diagnose a psychiatric disorder, we shouldn't have preserved function. Okay, that's the whole thing. That's how psychiatry comes about, right? Like all of us can have our ups and downs. You can feel sad sometimes. You can feel happy sometimes. Every time I'm sad, I'm not depressed. Every time I'm happy, I don't have mania. Every time I don't sleep at night, I don't have. It only becomes a disorder when my functioning is impaired. This is very important. If you have a psychiatric disorder, your functioning needs to be impaired, at least to some degree. Unless it's just like one of those defense mechanisms, okay? Sometimes it can be mild, but very rarely. But at least overall, you need to remember, if it's a psychiatric disorder, your functioning needs to be impaired. Pressured speech is something which is quite classic of mania. You know, people with mania, they like talk really fast. They're just in a hurry, they're very excited, they don't need sleep, they don't need food, they are like on cloud 9, they think they can achieve great things, and last about a week, have pressured speech, all of that. Okay, that is not with depression. Depression, you'll just have like very blast speech, you don't want to talk, you'll talk slowly, etc. Symptoms must be present for at least 1 month. Again, no, for depression, 2 weeks is also enough for a diagnosis. Okay, so for depression, you have like SIGI caps, which you need to remember, which is loss of sleep, loss of interest in doing things, guilt about stuff, loss of energy, loss of concentration, loss of appetite, psychomotor retardation, like he doesn't feel like walking around or doing anything, just become very lethargic, psychomotor retardation, and suicidality. Okay, so SIGI caps. So at least 5 of these symptoms need to be present for more than 2 weeks. And at least one of these symptoms needs to be a depressed mood. Then you will diagnose it as a major depressive disorder. Okay? At least 5 of the symptoms of SIGI caps need to be present for more than 2 weeks. And at least one of these symptoms needs to be a depressed mood or anhedonia. Then you will diagnose it as a depressive disorder. Remember this. Depression is very common. You need to know depression, you need to know schizophrenia. You need to know what is a diagnosis. Okay?
Thanks for watching. Please give a thumbs up and subscribe for more.